Right on the heels of the podcast on chest wall blocks, including the Serratus block from Andrew Herring, we're going to hear about a phenomenal case that Patrick Ockerse is going to talk about, where he performed his first ever Serratus block. This podcast shows me how easily the skills of ultrasound-guided procedures can be transferred to other procedures you've never done in your life. For example, if you do 10 ultrasound-guided IVs, your first ulnar nerve block is going to be a piece of cake. Patrick had never before done this particular block, the Serratus block, but he just nailed it. Pat is a guy who's willing to learn new stuff. I'm stoked this dude's willing to try it, and I'm sure his patient was really happy about it as well. Additionally, baby Mike Stone is terrifying, but super smart. And now, on to the podcast. Oh, and if you want to come hang out with us in an all-inclusive resort in Mexico and maybe do a little bit of ultrasounding as well, including learning a little more about the Serratus block, check out CaboFest2018.com.
A little bit better place than we had earlier.
I can lift you up. I can show you what you want to see and take you where you want to be. You could be
If you're not good enough at ultrasound, that's not an excuse to punish your patients with radiation.
Get out there, ultrasound some hearts, some lungs, some IVCs. Let us know how you feel about it.
Yeah, we can definitely do that, or we could be better clinicians and use our ultrasound.
Hey everybody, Mike here from the Ultrasound Podcast. We have with us here today a special guest, and that's Patrick Ockerse, who is the Ultrasound Fellowship Director at the University of Utah. All around badass, Mike Stone t-shirt wearing, great guy. Pat's been harassing me over the last, what feels like eternity, about this case that he had recently where he did a Serratus nerve block. And the guy had a great outcome, and Patrick's just been itching to talk about it. So obviously, we had to bring somebody here with us, Mike Stone, to keep us honest, teach us a thing or two about something we really don't know anything about. And Patrick, I'd really like to hear this story. Where'd you learn about the Serratus nerve block?
I think the first time I heard about it was at CastleFest, and I'd certainly heard Mike talk about it in the past, and some other people use it. Then I forgot it promptly, and then remembered it on this shift, and it worked out perfectly.
So Pat, do you want to tell us a little bit about the story, maybe kind of what happened and the whole deal?
Yeah, so just like any good trauma, this involved a man and a motorcycle. And basically, he got sent in for what was an obvious leg tib-fib fracture. And throughout the course, it was clear that the real cause of his pain was coming from his ribs. And so as he got worked up, the chest x-ray showed a couple rib fractures. And I believe at this point he was upgraded to a trauma evaluation and got a CT. And obviously you can see a bunch of broken ribs on the left. I think he broke ribs 4 through 10. And if that's not obvious, here's a bunch of close-ups to him. So here you can see a bunch of posterior and lateral rib fractures on the left side. I think he broke ribs 4 through 10, and he was in a significant amount of pain. Basically, this is a tough guy, and he was welling up with tears over this pain. This guy was much tougher than I am, and just a general all-around motorcycle riding badass. So I felt pretty bad for this guy. I thought, man, there's got to be some way I can help him. We were giving him some morphine, and he was starting to get a little hypoxic. And I remembered that this nerve block existed, so I quickly re-educated myself with 5 minutes on YouTube and talked to the guy about it. And I told him I'd never done this nerve block before, but I've done many other nerve blocks. And I was fairly confident that this could help him.
Hey, I don't really know what I'm doing, but I watched the 5-minute video on YouTube. I think we could probably do this. Nice.
It felt like Mike Stone's hands were guiding my probe with me.
Do I have a say in whether it felt that way? I'd like to retract my permission for your hands to feel it.
And Patrick, did that feel good?
It was like that scene in Ghost.
still more
Oh no. I hope it wasn't a masterpiece.
Well, it's not now.
Can I help?
Yeah. Patrick, get him wet. Now just let the clay slide between your fingers.
So I basically talked to this guy, and he was willing to let even an idiot like me try this because the pain was so bad. So I found my landmarks. I rolled him up onto his right side down, left side up, and put the probe in kind of the posterior axillary line.
So, hold on. So rib fracture side up.
Rib fracture side up. That's correct. And I think that there's a lot of different approaches to this, but given his tib-fib fracture, this was the best way to kind of approach it in him, I think. And here you can see kind of the anatomy, and there's a couple layers of kind of superficial muscle mass, superficial to the ribs. And the goal of this is to inject the anesthetic kind of superficial to the ribs and just deep to the serratus anterior. So here you can see the muscles highlighted. And the serratus anterior is in blue, and we want to go between the rib and the serratus anterior. And I was really excited because this was my first large volume nerve block, and really couldn't wait to try it out. So here's the path that the needle was intended to take. And you can see I did this under kind of full sterile precautions. I used a probe cover, betadine, everything. I wanted it to go as well as possible. The patient was on a monitor the whole time. Obviously, we're close to the lungs and want to make sure that we don't, inject into his lung, cause a pneumothorax, inject intravascularly, etc. So here at the top of the screen, you can see the needle tip starting to come into view. And then as I advanced, I injected a little bit, and you can actually see I'm injecting into the muscle belly of the serratus anterior itself. So I need to go a little bit deeper, and I did, and I injected about 25 mLs of 0.25% bupivacaine, preservative-free, and you can see kind of the layering out of the anesthetic. And let this kind of spread across the ribs, and that was it. The procedure was done. So I came back to check on him about 20 or 30 minutes later, and he went from looking like a crying, tearful badass to a slightly smiling badass.
That's pretty awesome, Patrick. Real quick, you were talking about you're injecting into the actual serratus here. I just wanted to sort of point that out to everybody if we could. So I think it's this one right there. So this is, how can you tell that's going into the muscle belly itself and not under the serratus?
Yeah, so basically you can see the fluid dissecting into the muscle fibers, and it's not dissecting across the fascial plane where I want it to be.
So it's not lifting up the entire muscle and kind of tracking along that plane. It's like a bolus of fluid as opposed to like a thin stripe of fluid.
Correct.
Cool.
And I think it's also important to remember, like when you first inject your anesthetic, you want to make sure you don't have any air in the needle because that can totally destroy your entire ultrasound view.
Good point. Good point. So on a scale of 1 to 10, easy factor is?
Which one's easy?
1.
5. Solid 5.
Seriously, I mean, you've never done this before. You heard about it once back in April, and then just basically read a couple of blogs, or you watched one YouTube video?
Yeah, so I found a good kind of foam website and read a quick article, watched a quick video, and then did the block. Honestly, I re-educated myself in about 5-10 minutes. And I happened to have some time on this shift, so it was the perfect shift to try it out on, and it worked really well. I'd say I would do this again. It was practice changing for me because it significantly changed his pain. And this is a guy that was getting admitted to the ICU so they could do more aggressive kind of pulmonary toilet, as they call it, to prevent pulmonary contusion. So I'd like to think that we changed the course of his management, and he did well. He did end up getting an epidural block for his rib fractures about 24 hours later. So it lasted a pretty long time as far as I can tell.
Did you use Lido or Bupivi or?
I used bupivacaine, and I made sure to calculate kind of my max doses that he could tolerate, and I was well within the window there.
Sweet. Stone, what are we doing here? What nerves are we blocking? What's this whole serratus block BS?
The serratus block is one of the weirder blocks. One, because we don't know that much about it and it hasn't really been prospectively studied at all. And two, because it sounds like, Patrick, like you were injecting above the rib deep to the serratus. Is that right?
Yeah.
It doesn't matter whether you inject above the serratus or you inject deep to the serratus, which is really just odd, right? We spend so much time talking about getting into the right space with ultrasound and putting that anesthetic in the right plane. And in the one 4 healthy volunteer study that the guy who described this block did, they took healthy volunteers, they blocked them with an above or below the serratus approach, and then measured anesthesia, and also they used like a gadolinium tagged injectate, and they did MRI to look where it spread. And it doesn't really seem like it makes a difference. It was a slightly longer block if you did it superficial to serratus, but it was a long block either way. So it's kind of a cool block in that sense that it's forgiving enough that if you feel like you see the plane above serratus, superficial to serratus really well, or you see the plane below it really well, you're probably okay either way to go towards either of them. In terms of what we're blocking, this is the easiest way to think of the serratus plane block is to think of it as a tap block for the chest. It's basically hemisensory anesthesia to the chest wall. And what we're blocking is the lateral it's the lateral thoracic nerves. They're basically the intercostal nerves that emerge from the intercostal space and come out through serratus and then give off their lateral and anterior branches, or posterior and anterior. I don't know. I need to look at a nerve block or a nerve anatomy textbook to get this stuff straight. We used to do this with 2 options. You either had a thoracic epidural, which is where most of these people end up getting, and it's usually 18 to 36 hours later when it's convenient for anesthesia or the pain service to do it, or a thoracic paravertebral block. And a lot of people, we have some experience with doing thoracic paravertebral blocks. I don't have any experience doing thoracic epidurals. And I've probably done 2 or 3 serratus blocks ever. So, it's a new technique. If you start looking at the web resources around it, all of them have disclaimers like, we don't know that much about this yet. More research needs to be done about it. It seems to be really safe. It's certainly injecting into a muscular plane as opposed to a paravertebral block where you worry about the needle slipping into the epidural space or injecting into the facet or, getting off track someplace more neuraxial where you could have actual central symptoms. This is often a plane block and seems super, super safe as long as you're staying out of the pleura. But you're getting the thoracodorsal nerve, you're getting the long thoracic nerve, and you're getting these lateral thoracic nerves out of the intercostal nerves.
Yeah, we've never really been known to talk about anything without any research behind it on the podcast. That's definitely a first for us.
Whoa. Baby Mike Stone has some high-yield tips up his sleeve. There are so much more where that came from. Stay tuned for the next episode to learn more about these amazing blocks that can elevate your game. In the meantime, check out CaboFest 2018.com and learn how you can get some CMEs while having the time of your life in Cabo, Mexico.
Cabo was freaking amazing.
Yeah, it was. It was so amazing that on the last day of Cabo Fest, we were already talking about the fact that we need to do this conference again next year.
Absolutely. A perfect 72 degrees, constant sun, the beach, pools, margaritas, scanning. It added up to be one of the best experiences of our lives.
Getting to hang out with you amazing people was definitely the best part, though, and we're still glowing from the experience.
Of course, some of us got a little more intimate with the attendees than others. But in all seriousness, we had tons of fun with our families and the course participants, and the resort was totally incredible. Great food, beautiful views, and it was completely all-inclusive.
So here's what we're going to do. We're going to throw the biggest party in the history of ultrasound parties.
Next year, we found out that there's an amazing all-inclusive resort that we can completely take over and own the entire place for a week. And we're going for it. Same incredible setting, same incredible instructors, just bigger.
But to pull it off, here's what we're going to need from all of you. Tell everyone you know about Cabo Fest 2018 and tell them that we're giving them a discount if they register early. 10% off registration if they sign up before July 1st.
And we're doubling down on the fun this year. We're snorkeling, scanning on a cruise ship, surfing, racing dune buggies in the desert, deep sea fishing, zip lining, and having faculty and attendee dinners every night.
We swear, it's going to be the most fun you've ever had at an event. Seriously, if it's not the most fun you've ever had at a conference, then we'll refund your registration.
Does that sound crazy? You're damn right that sounds crazy, but you don't understand.
You haven't been there, so fix that and register now. Go to CaboFest2018.com.
Oh yeah, you know what? We almost forgot. We're not the only ones that are going to be there. Check this out. We have Rob Rogers will be doing his fantastic teaching course. And yes, Master Educator Amal Matu will be there running an amazing ECG workshop. And there's going to be a lot more incredible educators coming. But more on that later. For now, register for Cabo Fest. And you know what else? You can sign up for some of the conference, or you can sign up for the whole shebang. This is your vacation CME, and we want you to customize it the way you like.
So, order your Speedo, slather on some tanning lotion, and register now at CaboFest2018.com. See you there. If you're not good enough at ultrasound, that's not an excuse to punish your patients with radiation.
Get out there, ultrasound some hearts, some lungs, some IVCs. Let us know how you feel about it.
Yeah, we can definitely do that, or we could be better clinicians and use our ultrasound.